June is Alzheimer's and Brain Awareness Month. So what can we do to prevent Alzheimer's and prolong brain health? Here to tell us is Dr. Paula Walker-King. Nice to have you here.
Great to be here.
Yes. So first, let's talk about what is Alzheimer's disease.
Alzheimer's disease is literally this slowly progressive brain disease that involves the destruction of neurons or brain cells over time. And as a result of this deterioration of brain tissue, it leads to impairment of mental tasks, such as a person will have problems with memory, they have problems with thinking or reasoning, and other social impairments will be evidenced in Alzheimer's disease.
And it shows up in MRIs?
Yeah, because exactly. So there are actual structural changes that coincide with the diagnosis of Alzheimer's. And so you will see where the parts of the brain are impacted by this disease. So that's why Alzheimer's is a little different than dementia. Alzheimer's is a type of dementia in that, you see some of the mental decline and decline in cognitive functioning. But dementia in and of itself is just those constellation of symptoms. It's not necessarily a disease process itself. Alzheimer's, on the other hand, there are some structural changes that occur to the brain as a result of the disease.
What causes Alzheimer's?
We really don't know in terms of the etiology what causes it, but we do know that there's some contributing factors. So genetics tends to play a role, lifestyle plays a role, which we're going to talk about in a moment, and then environmental issues also play a role. Now, risk factors, advancing age tends to be the most prominent risk factor. Any past history of head trauma, as well as a family history of the disease. And so if a parent had Alzheimer's, that individual might be slightly at increased risk for developing the condition.
Is there a screening for Alzheimer's?
There isn't a screening just yet, and so we're working on that, and so that would be ideal.
Yeah, that would be ideal.
But in the meantime, we just have to maximize those lifestyle interventions that stave off any type of cognitive decline and actually help preserve brain health.
So how do we prevent this from happening?
So the studies are really convincing that lifelong learning and social engagement are the key to preserving brain health. So we've got to, frequent social interactions, taking on something new, learning a new language, learning a new skill, all of that keeps our brains healthy. Physical activity, there's strong linkage between being physically active. So making sure that we are exercising most days of the week, it increases blood flow to the brain and keeps that brain healthy.
Another reason to exercise, right?
That's right. Can't get away from it.
That's right. All right, Dr. Paula Walker-King, thank you so much for your insight on that subject. And let's go to Lauren for the weather.